We're live.
Hey, audience, welcome back, and thanks for listening to our content. This is the Walk the Talk America podcast called Guns and Mental Health, hosted by yours truly, Jake Wiskerson. I'm alongside Mike Sedini. Well, not really alongside, we're facing each other. You're some 450 miles away. And in the great state of Colorado, we're joined by Dr. Emmy Betz. Hello, Emmy. How are you?
Hey, nice to see you guys. Thanks for having me.
It is nice to see you, and I'm glad that we're having this conversation. For the people who don't people with a B, for the beep people who don't know, we're bringing Emmy on because we've worked with her for a really long time in a kind of behind the scenes capacity. She's got a lot of work that she's doing on her own. She's a psychiatrist by trade and also does a lot of research, oversees several programs in the so-called gun violence prevention realm. you know Same stuff we do, which is trying to mitigate the negative unintended consequences of firearms usage. And she does a lot of really good work, and she's been doing it for a really long time, longer than since I've been around, which is 5 years, which feels like an eternity now. But we have never really had her on to discuss like the depth and breadth of what goes on in our collaborative partnerships, and there are plural, across many domains. So there's been some controversy, I guess you could say, if the people who are listening are in tune to gun community drama. And the controversy seems to center on where the funding comes from and the motivations are and what the hidden motives are and if there's agendas. And really the only agenda we like to say is we're trying to save lives, and we're trying to save them in the best way possible with the most intellectually honest evaluation of data and research that we have. So that as the backdrop for what we're going to discuss, I would like you to introduce yourself a little bit further beyond what I just shared and tell everybody who you are.
Yeah, for sure. Thanks, Jake. Although I feel like maybe you called me old when you said I've been doing this a long time, but I'm sure you didn't mean.
I only this work. Yeah, I am
Wait,
also old.
what
Yeah.
position did you get? Wait, what position did he give you, Emmy?
Oh, well,
Like,
also, I'm not a psychiatrist, sadly. I'm an emergency
Oh,
physician. I'm definitely not.
oh, I
So,
thought you were. Man,
no, it's good.
I thought you
Listen,
moonlighted as one. Maybe I was like, what? She didn't tell me something. I mean,
no,
I've
no,
known
no.
her
but
for a
So
long time.
that's
you
the
got
part.
an MD though.
Yeah. So I have an
Yeah,
MD. So I'm an ER doctor in Denver. So I work with a lot of people who are suicidal, which is one of the
sorry
things that
about that.
really got me interested in this space.
Different
Not
residency. Sorry.
different residency. It's okay. I love my psychiatrist friends and psychologist friends, but I'm a
Some of my
jack of
best
all
friends are psychiatrists.
trades. I will say if you're on a plane in an emergency, you might rather have the ER doc, but I guess it depends if what the emergency is. So
Yeah, the psychiatrist can talk to you about how you feel about the emergency. The
if the yes,
the MD,
so
the ER doc can actually stop the bleeding.
oh yeah, so yeah, so I'm an ER doc based in Denver, proud native Westerner. I'm a Colorado native, and I have been working in this space for probably like 15, 20 years now. I got really interested in the intersection of firearms and mental health because care for a lot of people with suicide risks. So a lot of people who are suicidal end up in the ER one way or the other. Either their family brings them in, or if police or ambulances bring them in. And I realized I had never been trained in how to have respectful conversations with people about not just getting the psychological help they might need or substance use help, but what they could do at home to make their home a little bit safer while they were getting that help. And specifically, that it might be a good time to make sure somebody else retains access to the firearms for home defense, or sort of thinking about that piece of kind of like a designated driver, right? If you're not at your best. So I realized I had never been trained how to do that. And that's kind of what set me down this path. I've also lost family and friends to firearm suicide, and so it's personal for me as well. And so I really came at it initially from the perspective of a doctor who I'm training to meet people where they're at in a really non-judgmental space and help them find the thing that's right for them. So that's the way I've always approached this work. Isn't like partisan politics have nothing to do with the way I take care of people in the ER, and that's the way I approach my work as well. And so over past decade plus, I've built up a so as I was saying to you guys at the beginning, I'm also a big nerd. At the end of the day, I'm just like a geeky doctor, scientist person. Yeah. Are you pointing at you or me? I'm not sure.
Me,
You're a nerd too.
me.
Okay, good.
I'm the only one in my office.
Yeah.
This would be you.
And so, part of me was like, well, okay, how do I talk to people? But like, what's the most effective way? And like, what should I be offering them things? And if I'm operating locking devices, like, which ones should I offer? And so I had all these sort of questions around the best way to do it. And so over time, that led to then building teams of researchers and community members to try to figure out programs that are going to be effective. And that's led to our most recent project, which is called Pause to Protect, which I think we're going to kind of get into what that is. Also, over time, I'm at the University of Colorado. So I've built a program called the Firearm Injury Prevention Initiative, which is kind of that vision writ large, which is nonpartisan collaborative approaches to helping prevent all forms of firearm related injury. So we don't do advocacy for or against legislation. We're certainly interested in the good or bad effects of legislation, but really we come at this much more from how do we work with communities to find solutions, help them find solutions.
That's a good
And
overview.
that's and then I think I met you guys a long time ago.
Now you're calling us old. Yeah,
I know.
all right.
Yeah.
But when I can't, I mean, I feel like
There's
the COVID era, just
It
like
was February of 2020 in San Francisco at the VA summit on lethal means prevention or reason. I forget what they called it, but it was, to my knowledge, and correct me if I'm wrong, both of you guys, I think that was the first time that the VA had actually embraced the phrase lethal means and its direct relationship to firearms. Yes.
I'm not a historian, so I don't know if that specifically is true. I think it was for sure the first big meeting they had about it. Because I know people who had already been working within the VA space, either with patients or in research, but I feel like that did kind of launch their partnership also with NSSF in really saying we're going to tackle this in a way that is meaningful and will hopefully support veterans.
Emmy, so we actually met. I don't know if we met before the White House or in 2019. 2019 was when we were on the prevents team in the White House.
That was at the White House. That was before the 2020 thing. Yeah. See, it's all like jumbled.
And I mean, one of, and this is what I love about, our community. We feel like we're never heard, but I was invited to the White House to be heard by the VA and a lot of researchers. And I walked into a room and realized I was the only person for the firearms industry there. And at that time I was really in the firearms industry, like not just Walk the Talk America. I still owned a gun company, and it's kind of funny because I think about it. We've worked across 2 different administrations. We've come full circle now. We're back at where we met, right? Under the administration where we met. But the way I see things is that we can be in a room with people we disagree on subjects about, right? Like, I'm going to just throw the elephant in the room. It's like red flag laws, right? I know certain people in certain rooms believe in these things. They believe that they're good. I take another stance. What I've always appreciated about you and people like Megan Rainey is like, you guys have never come down on me for my belief in these things are awful, right? Like, because we live in 2 completely different worlds, right? You see sides of, this thing as, hey, it's important because there are times when somebody needs to be separated, time and space, that type of thing. And Jake and I live in a world where people are like, hey man, I'm not getting help because I'm afraid to, or this red flag law, I would never do that because it could be weaponized, or, those type of things. But we've always coexisted. So, I feel like I was happy that you're coming on because I appreciate the private conversations that we've had about this stuff. I mean, it's no different than me talking to a regular gun person that just wants to save lives. You know what I mean? And I think people miss that. I think it's harder for people to come out from your space where it's just like, being an ER doctor, working in suicide prevention and mental health, but not being from the gun community, but still respecting guns or having a history of guns in the family and listening to, we always say in the gun industry, like nobody listens to us if people just took the time to sit down and listen to us. And I'm like, yo, they're listening. Like they were listening. That's why I'm there. That's why I got to Aspen, at the Institute the festival, in Aspen. That's why I got to the White House. So I just kind of wanted to give you your flowers there. I've always appreciated, our relationship and the work we've done. And I've always felt heard,
Well, thanks. And, right back at you guys. Like, I think the way I come at these is like, so first of all, I know at the end of the day, we all have a common vision, which is we want our loved ones to be safe and healthy and happy, right? And I think that's true of everybody in this country. And people may disagree on aspects of how you get there, but like, I really believe if we hold that goal together, that we can find a lot of ways to work together wherever people are coming from. And so I've worked with folks on all different, it's not just a spectrum, it's like a crazy star of people, all different kind of viewpoints. And I think I so appreciate this, what is happening in the field of our ability to work together, because I think particularly at a very divided time, I find it incredibly refreshing to work with people with all different kinds of viewpoints and experiences. Because I also think that in science and medicine, if we really want to help people, we need to understand what those people want and where they're coming from. And, it's going to vary, like, depending on where people live and their background and so forth. And so it's not that what is right for you is right for everybody. But if I want to be supporting my patients in the best way I can, like, I really need that whole suite of tools and training in communication, and resources about how we talk about things and so forth. So yeah, I will, I just want to say at CU, this is the vision we have for all of our work. So we do work in domestic violence and suicide and community violence. And it's all very much based in this space that is, again, nonpartisan and community engaged to work together to find not just the solutions, but also the questions. Because you brought up a couple things, Mike, about extreme risk orders, for example. So, I think I have a lot of questions about how those laws might function, how they're used, what's wrong with them, what might be right with them. Is there an iteration that might be better in certain communities or other communities? Those are the questions we need to be getting answers to. And if people don't ask those questions, we're never going to get the answers. And so we have to be looking at any of these sort of questions from multiple viewpoints. So even just earlier today, I was talking to a friend in another state, and I said, hey, do you have any data about people who have an extreme risk protection order? How many of them then go get mental health help? Because I don't know that anybody's tracking that or recording it, because it's not the way the system was set up. But for sure, we need to know. And you guys talk about this all the time. So, I think this is where it's a two-way dialogue for sure, as we think about how we work together, and how we, again, try to get to that common goal of happy, safe, and healthy communities.
I like to go back to you being an ER doc, because that, in my mind, I thought you went the other direction. I thought you were a psychiatrist who went into the ERs, because there are some people who do that kind of thing, and for whatever reason that stuck. But I think it's more meaningful knowing what your original role is, and that your curiosity about this came from an organic place of, I mean, ignorance, right? Because you don't get trained on that kind of thing, just like I don't get trained in certain things in my realm. And there's, I think a lot of times what ends up happening, I'm saying this to the listening audience who may be lay people not familiar with the medical umbrella that encapsulates all of us, is that you get some really well-meaning folks who have a mission and a purpose, and then they go do something, but they forget to accumulate data along the way. They forget to have certain interviews, and then we end up with policies on the books that may be off-putting to certain groups, or even, because I have a lot of compassion for the medical community, especially in the primary care setting. These ideas like zero suicide is something that's been very popular lately. And the idea behind zero suicide was to train all the primary care physicians and the pediatricians and so forth to ask questions in the office to screen people for suicidal ideation, ostensibly to get them help. Very noble, but it's almost like they didn't bother to ask if that's even feasible in the office. So then we end up with this policy, or this, I say policy because that can range from just the institution's policy where you're working all the way up to governmental policy. It's binding across many people. And then the policy gets stuck, and the practitioners are wondering how they execute this thing, what time they have to do it. Then what do they do if they get a positive result? Somebody says, yeah, I actually am feeling suicidal. It's like, ooh, you just reached the end of my skill set. So I think what we want to do now is to try to, we can't unwind what's already been done. We can't unring any bells. But what we can do is have some more honest dialogue about the hiccups that may have been inadvertently created by some of these solutions or proposed solutions. And if you're wondering, how did we get to where we are? And there's a bunch of finger pointing going on. I don't have a short answer to that, but what I think we need to do now, and I think Emmy's group and several others are honestly endeavoring to get back to the problem at hand, establish what the problem is, then establish a goal, then establish objectives to that goal, and then finally do the intervention. And I think what happened was we inverted that process. We just started throwing interventions at people, and we didn't know how to measure the goal. So if the goal is fewer suicides, well, that didn't work, because for the last 12 to 15 years, we've been trying to stop suicides and they've only increased. So we got to have a more honest discussion about what it is we're trying to do, how to measure it, and then figure out what to execute to get that goal. And I think that's what your folks are doing. So just to lay that out for people who are wondering, like, why are we talking about this and how did we get so crossways? I don't think that most of us are crossways, at least not on this call. I think that there's a public perception driven by rhetoric that's made people think that we're crossways. And if we can battle some of that rhetoric, we'll all be in a better spot. So let's start with one of those questions, if I'm reading your mind accurately. How do we get people who are in suicidal crisis separated from the means that they would use to take their life? That's one of the things that we're looking at, right?
Yeah.
What do we know now that we didn't know, say, 5 years ago when all this kicked off?
Yeah. So I think even the way you phrase the question is really interesting. In how do we get people separated from something?
Yeah, presumes
Right.
that's the answer, right?
But okay. So just to get us all on the same page, we know that when someone is in a dark place and having potentially increased suicide risk, so could be for all kinds of things, mental health, but also losing jobs, et cetera, all kinds of things.
or physical illness.
Oh, total physical illness, breaking up, like life happens and life gets bad sometimes. And I think probably all of us, if we're honest with ourselves, can recognize when we've had low moments, even if we didn't get to the point of feeling suicidal. So we know if somebody has access to a gun at that moment, the likelihood of them dying is higher because guns are lethal. They're supposed to be, right? So this is the same as if you're intoxicated and you get behind a car, get behind the wheel of a car, you're more likely to die in a crash than if you were sober, right? Just because your thinking and your judgment is clouded. It's not that having a gun in the home makes somebody suicidal. I want to make that very clear. So when we talk about increased risk of suicide death from the presence of a firearm, it's because in that moment, there's usually not a second chance. And I work in the ER. I see lots and lots of people with suicide attempts, mostly overdoses. Almost all of them survive. I've seen, I think, 2 firearm suicide attempts in my life, and they both died in the ER. And the reason I haven't seen more is because they all died home. So there's no chance to get help. Okay, so we have a really good scientific rationale, and hopefully people understand sort of a gut instinct, like why, if you're going through something dark, maybe that's not the right time to have access to things that could permanently hurt or kill you.
May I jump in real quick?
Yeah, please do.
There's something you threw out there that I think is, we all agree that simply the presence of a firearm in a home, just like the presence of a pool, does not increase risk. But there are groups out there that do say that, and they do advocate for such things. Can we separate that out too? Because
sure.
there is that narrative.
Well, so it's because we do know from population studies, if you look, the risk of death by suicide is increased when there's a gun in the home. Like, that is a true statement.
Yeah.
But that's because if a person in the home attempts suicide and there's a gun, they're more likely to die. So there have been other studies breaking it down to show that, at least in our current state of knowledge, just the presence of a gun doesn't make someone suicidal. It may have some influence on sort of the method somebody picks.
Yeah.
But I do think it's an important statistic for people to know, particularly if you've got teenagers in your home. We know teenagers are at elevated risk of suicide because their brains are impulsive and not well formed. And so if they have access to guns at home, their risk of suicide death is increased. But you're right, Jake, like, people, when we talk about this, we sometimes throw out the statistics without explaining why that risk is higher, and it's in the midst of a crisis, the lethality
Yeah,
is higher.
it
Yeah.
might be a good time to flesh out correlation versus causation too. So there
Yeah.
may be two sets of data that are correlated very tightly
Mhm.
that suggest that there is a causal, and then some people will take that and say there's a causal link because, and that's not necessarily true. But I love what you said there. It's just that the presence of a more dangerous object when that time happens is probably going to be the person
Right.
reaching for the more dangerous object if they're serious about taking their life, right?
Right.
And it's not just
Right.
a cry for help or an attention-seeking
Right.
behavior, and I don't want to minimize
No.
that, but those things do happen. So we're separating correlation of presence of firearms in homes. Usually looks on the chart or the graph or the pictorial map like they're causal, and that's not necessarily true. And I think that's what a lot of gun owners push back on.
Right.
Just because I have a bunch of guns doesn't mean I'm going to be suicidal. It's like, oh, we
Correct.
agree with you. We agree with you.
Yep. And I'll just emphasize again, for those who have guns at home, the risk of suicide is increased if other people in the home have access to them if they're going through a rough time. So
Yes.
it's all about how we think about when someone is sober, thinking clearly, in an appropriate state of mind to be able to have access to a firearm. And I think people agree broadly with that like with ownership and use comes a lot of responsibility, and that's a good thing. So if someone is going through a crisis, and this is where I see in the ER, oftentimes, somebody doesn't, most of the time, people don't need to be admitted to a psychiatric facility. If they can get help as an outpatient, maybe it's that they lost their job and their girlfriend broke up with them on the same day, and things are going to look better in a few days if they have the support that they need. But we want to make sure their home is safe while they're getting better, right? And it's the same as like driving your friend home from the bar. So this is the analogy I always use, and sort of friends don't let friends drive drunk. In my view, the first your question, Jake, was how I forget how you phrased it, but something about how do we separate people or have people be separated.
Right.
In my view, and I think this is what the literature tells us, with adults, the first step should always be voluntary and involving that person. So we never want to jump to confiscation. We never want to jump to taking away independence from that person, because when someone is in a suicidal crisis, a lot of the sort of therapeutic approach, the treatment, is actually about skill building and helping them understand how to manage emotions and manage anger and all of those things. And so, of course, we want to be engaging them in making their own decision about how can your home be safer. And so maybe that's, depending where you live, can somebody hang on to your gun for you? Or can your spouse change the pin on the gun safe so that you can't access them for a few days, right? So like you want to engage them in that process so that hopefully they are making the decision. It's a little bit different with parents and teens, obviously, because the parents are the ones who have responsibility. It gets trickier if the person says, no way, man, like this is a non-starter, because then the whole decision tree about what's a safe plan and how we do this changes. But I think extreme risk protection orders or those kinds of confiscation approaches should always be the very last resort. The same way that if you're at a bar and your friend is drunk, hopefully you don't call the police to take away his driver's license, right? Like you make sure he gets home safely. Maybe if he's an alcoholic and is out every day and has almost killed a couple kids, like you take it up a notch. But I think that's the way most of us doing this work, I think, really think about this, is more that behavior change encouragement with the firearm owner who's in crisis, or their family member. And so then the next level that got me really interested was like, it's one thing for me to say to somebody, hey, you should really lock this up or you should do something with it. What if they then say, okay, like what? Like, what are my options? Can I take it somewhere? I don't have a safe. What do I do? And the ER doctors, we really like solutions. And so that then led us down all these pathways of thinking about, gosh, where can you store a gun voluntarily? What are your temporary options? Will a gun store down the street hang on to your guns for you? Is it legal in your state to give them to someone temporarily? Could we give out gun locks from a hospital or an ER community setting? And if we're going to do that, which ones should we be giving out? Like, which ones are people going to use? Probably not cable locks, because a lot of people don't like them. But so that sort of then led to all these options, because it's just the education's not enough if you want to encourage the behavior change. It's about how do you actually make it easy for people to take that step. And so that sort of has led to our whole program of work, which is really around, in my opinion, helping patients and their families, or non-patients, but people in the community, pick the thing that's right for them. Because for one person, it might be changing the locking device at home. For another, it might be storing it at a gun range. And who am I to tell you which of those is right for you, right? Like, I can help you understand what your options are and pick, but I think we really need to be giving people that choice and that agency.
Right. Oh, I thought Mike was reaching for his mute button. If not, I'll
No.
follow
I
up.
just was like,
We're
no.
not muted.
No. I appreciate that, Emmy, and I guess my question to you is, I've come kicked through the door, said, hey, these red flag laws need to be changed. I know Colorado's got some interesting ones, right? Like, there's a lot of people that, if they're listening from Colorado, are going to be like, it's horrible here. How does our voice get heard
Mhm.
to where people might understand these fears? Because as much as you have heard me, and we've had these real nuanced conversations, I feel like you have better access to people who listen than I do, but maybe I'm wrong. You know what I mean? Because I just feel like I'm going to give one example, right? Megan Rainey and I disagreeing on stage in Aspen turned out to be an awesome moment that a lot of people came up to me and complimented. They said, you two were awesome the way you guys kind of did jujitsu on that, right? She disagreed with my stance on it and went the positive way of a red flag law, and I went straight to the negative way, right? But we were fluid the way we were kind of talking about it. And I had a lot of people after say, damn, Mike, like, I didn't even realize that these red flag laws could be a barrier to entry. You've given me something to think about. I still don't like guns, right? Which is fair. That's fine. I'm not trying to win you over. I'm just trying to make you pro understanding, right? I don't need you to be pro or anti. I need you to be pro understanding. But that many people, and there's some of the most brilliant people walking around that campus. I know they were a lot smarter than me, right? Like, I could just tell by the way they talked and the way they moved. But how do I get people to hear these issues, and how do we either get rid of these things and recreate them in a way that makes sense, or at least change a law that has some goofiness to it,
Yeah, it's a great question, and I want to emphasize too here that I think uh like, smart is one part of this puzzle, right? And I acknowledge, like, I'm a big dork at the end of the day. I'm not making money off this. Like, I just like the puzzle solving, problem solving. Um, but each of us has opinions and lived experience that is really important. And I think the way I have always approached this, and I think that's what has helped, for example, in my interactions and collaborations with you guys, is honesty and transparency, and truly being willing to listen, and to admit when I don't know something, to admit when I'm wrong, and, like, to be open to looking at something in a new way. And I think that's where sometimes these discussions break down on both sides, of people clinging to, like, their own position, whatever it is, whether it's red flag laws or something else, and just, like, shutting it out. I mean, I think that's a bigger problem in our country right now, is, like, we all live in our echo chamber bubbles, right? And I gotta say, it's really cool to have your thinking challenged on something, or to think about something a new way. And I don't, the policy question is a hard one, and I stay out of the policy arena for many reasons, but especially because how it has to do with trust and things. But I will say, in Colorado, or if you're anywhere else, um, we would love to hear your thoughts on things like, what questions do you have around how laws are being used? So right now, for example, we run a database where we get every red flag law or BO petition from Colorado, and we extract the data from it so that we can look at, how are they being used? What counties are filing them? Is it law enforcement? Is it family? We'd love to know more about what happens afterwards. We'd love to know more about, do those people get the mental health treatments that they need? Unfortunately, that's not in the legal records, so we're somewhat limited. Um, but we want to know the questions people have so that we can help make things better, right? I think so it's like I can't just tell everybody like come talk to me and I'll listen. There are many of us who genuinely want to be doing this work in a collaborative way, and I think approaching it with respect, a willingness to listen, like a willingness to share, I think is the best way to do it. And thankfully folks can also contact you guys, and you've got a growing network as well. But um, yeah.
Well, on the topic of that research, I mean, one of the questions is like, why research? If we know what the problem is, what are we researching? And you laid out a little bit of it. You're tracking the efficacy of these laws and whether or not they're useful or whether or not they're being abused. I'm sure that's part of it. But you made a really good point about we don't know who's getting help. So in New Jersey, I do believe, and I might be the only one where mental health help is required as part of their ERPO, whatever they call it. It might be, I know California's called a gun violence restraining order. They're called different things elsewhere, but mostly we're just saying ERPOs and red flag. Why can't we get some research, and maybe your people can do this, to say, hey, we're missing this piece. And I love policy. I'm a policy wonk. I mean, I have to be very careful because Walk the Talk is a 501c3. We're not allowed to go into that realm, but we can certainly have opinions on whether or not we think something works. And if I could step out of that for a second and just as Joe Citizen or Jake Citizen, I would say, I'm not a big fan of the state mandating thing, so very, very clearly hear me. If we're going to have something on the books that says thou shalt require the state to step in and separate person from property, then the state ought to also require follow-up care, and the state ought to also pay for it. And then we should track that, and then we would know how. Now, that's one thing that I would love to hear your answer on, and if that's even feasible. But the flip side of that coin is, I'm trying to figure out why suicide prevention hasn't spent very much time encouraging people simply to be healthy. It's all like intervention at the time of crisis,
Yep.
teaching people the assist trainings and the safe talk and the 4 steps to blah, 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 and how to validate properly. It's like, well, why don't we just train people to be well, know their emotional functioning, know how to tolerate when distress occurs, have a network of folks around them to lean on so that they don't get into that place of despondency, like Mental Health America refers to it as stage 4. And then we will still have that backstop, I guess, in the time of crisis. But it seems like the cart's been put before the horse, and we're only focused on the moment of despondency rather than putting our effort and energies into just staying well.
Yeah.
And so there's 2 sides here, I think, going on. One is the intervention strategy, which is now in law in many states, and it's incomplete. And then the other is the strategy of just staying healthy in the first place, so we don't even have to use those things. Thoughts?
Yeah. Couple thoughts. So first of all, I'm really glad that you're bringing it back to sort of the prevention upstream piece, and I'm going to answer that part second because that's actually what I would love to talk more about. Because I really, I think there have been some mischaracterizations around like the work that I do and that our group does in terms of advocating for ERPOs. We do not. We are doing research on them to understand how they're used, because I think you can't change or improve something until you know how it's working, right? So for example, one of the first studies we did was looking at, in Colorado during the first year, how many instances of gross misuse of the law there were, and we found 2 documented cases, and in both they were denied. So because there's
That's
been
pretty low. That's good.
yeah, but there's been a lot of understandable concern about, oh, my angry neighbor is going to take it out on me and so forth. So we looked through all the records to see how often that happened, and it didn't happen very often. And when it did happen, it was stopped. So like, I think that's an important question to answer. When we do work on extreme risk orders, it's not because we think they are inherently a good thing. I will tell you, as an ER doctor, I have seen people in situations where I broadly think it's good that there were ways for us to make sure that they could not harm people. That maybe there needs to be certain legal resources for that, and often it's hospitalizing someone. But Okay, so I want to emphasize again the work that we do is very much nonpartisan, non-advocacy, but we're interested in the questions around how laws are used so that we can answer communities' questions and hopefully, make sure things aren't being misused or abused. So to the prevention point, because this is like where my heart really is how do we move upstream? So again, I'm an ER doctor. I see people at this point of crisis. And this is what kind of started for me this question of like, how do I talk to this person in front of me to help him or her get back to a better place? But a lot of people don't come to the ER because, as you mentioned, they might be worried about losing their rights or losing their guns or whatever it is, right? They may not make it to me. So actually, almost all of my own portfolio of research now is in the community because I think it's really important that we get outside of clinical spaces. And this is where we started then doing work, for example, with firearm retailers, trying to understand. There was a so-called gun shop project that had started many years previously in New Hampshire and other states, sort of recognizing like the potential for suicide prevention messaging through retailers and ranges as a way to help get those upstream messages out. So we started doing some work like that and just thinking about really through conversations trying to understand where could we partner and like what are options for us that would be helpful. Where could we as an academic center support a business, for example, and we have one project right now with a local business where they're testing out kind of different discounts for storage devices to understand what people want to use. So we can bring some of the like how to model it so that you can get an answer from it, but then they're running the program themselves. But over time, I think I came to the same conclusion in many ways that we need the suicide prevention at the point of crisis, which is kind of like the designated driver. Like your friend is already drunk and trying to get behind the car and you're trying to get the keys away from him, right? Like, or convince him to take an Uber or a Lyft. But how do we move upstream? And that's where I think about sort of the seatbelt analogy. Like you put your seatbelt on every day, hopefully, because you don't know what's going to come that day. Like you don't know if somebody's going to come barreling out of the blue and hit you. And that's where our latest program, which is called Pause to Protect, is much broader messaging. It's actually not just about suicide prevention. It's about why secure storage of personal firearms is a good idea for many reasons. So for prevent theft, to prevent suicide, sure, but also prevent kids from getting in trouble or having accidents. Sort of emphasizing the positive aspect of responsible ownership and storage as opposed to sort of only the doom and gloom of suicide, because a lot of people think that will never be me. I will never be in crisis. My family will never be in crisis. We know that's not always true because bad stuff happens. And so I think that's where I'm excited to see that the field is moving more towards positive messaging around secure storage, maintaining access, ensuring that only qualified, trained people have access to firearms and so forth, instead of just the sort of like intervening in crisis. I hope that kind of answered your question. So Pause to Protect is working with military communities to try to help build that positive messaging for people.
Yeah, it does for sure. And I think that speaks to what Mike has said for years and years, which is we want the firearms industry to get to where the alcohol industry got with the drunk driving campaign. Like .gov didn't have to step in and tell the alcohol industry to start doing its campaign. They just did it on their own. And I think that's happening now. And something I wanted to say earlier, but this is a good time to say it, is that these things take time. So the listening audience, it sounds like we're not moving anywhere. And I would say that it takes time. And I would say from my chair, we are moving quite rapidly because 5 years ago, nobody even discussed this. Now here we are. And actual programs are in place by multiple entities across multiple states and multiple different funding sources. So, Wisconsin's got a good gun shop project that's been in place for a long time. I didn't know New Hampshire was the origin of it. That's news to me. That's good to know. Colorado, obviously. Nevada is now working on one at the Washoe Suicide Prevention Alliance. There's homegrown organizations, the Armory Project out of Louisiana, TAP, with Galatru, who's been a friend of the show, Galatru. It's all this organic upswell. And now we go to conferences, conventions, trade shows, whatnot, tabling events. And the discussion is not I don't know what to do about this or think about this thing. It's I'm now taking action thanks to you guys or thanks to whatever, right?
Yeah.
And I think it's really important that whoever's in this space trying to keep people more secure, more responsible, and keep people from dying unintentionally, that we don't become proprietary about our efforts. Like the whole point is to work ourselves out of a job. And it's unpopular speech in my community to say that. I say it all the time. I'm trying to work myself out of a job. If everybody's mentally healthy and I have to shut down Zephyr and I still got years on the lease, I could turn it into a brew pub and coffee shop. Be stoked about that because everybody be healthy. If we end this issue by all the people doing all their things, it doesn't matter whether, Johnny Walker has one message and Budweiser has a different message. The point is the message should be think before you drive after drinking. I don't care how you get there, and I don't care who gets credit for it. So I think sometimes we get a little wrapped around the axle of who's taking credit and whatnot and that kind of thing. But the point is we are moving. And if we continue to be patient and sane about our conversations, we will make a dent and we will move the needle. And anecdotally, I can tell you that Mike and I get messages all the time about stuff that we've done that has literally saved lives. And it's like, that's cool. But then we ask people, to support the project, and they're like, well, show us the research that it works. It's like, well, how do I prove a null? How do I prove that something didn't happen?
Well, so a couple thoughts if I can jump in. So I want to clarify that everything that you just said about sort of people, everybody can jump in and do this their own way. So the way we built Pause to Protect very intentionally was to help businesses do just that. So it's all sort of positive messaging and so forth, and they're materials for the consumers, for their customers, that are very much about helping customers pick what works for their family. So there's no one size fits all solution. It's very much in line with messaging from other organizations around understanding the different kinds of locking devices and so forth.
Well, that's how we get those options that you talked about too, right? Options are a good thing. You can't just do it one way.
But then we also wanted to give options to the businesses. And so we recognize some businesses may have the space, the capacity, the interest in storing weapons for people voluntarily. And there are nuances around how you do that and if it goes on the books or not. We're not going to tell people to do that. It's none of our business if you want to do that as a business or not. We will give you the templates, storage templates, sort of sample manual procedures. Our team has these phenomenal outreach coordinators. One of them is a co-owner of a large range and retail organization here. And so she'll tell people sort of how they do it at their shop. But for places who don't want to do that, then there's other materials about how they could do education. We actually, for the groups that are official Pause to Protect partners that are surrounding certain military bases, we actually give them money directly that they can do whatever they want with, as long as it's promoting secure storage. So they can buy locks to give away. They can put lockers on site. They can, again, like, it's about that choice. And so we want to be a partner helping them know the evidence and sort of some of those resources, but then they can pick what works for them. And so we're happy to include resources and links to a whole bunch of other programs so that they can see maybe that, like the Armory program, if there's somebody nearby who has a similar model. Like we don't make money off of this. We're not trying to own it. The Department of Defense, through the Defense Suicide Prevention Office, cares deeply about this because firearm suicide is a huge problem in the military. And so we had this great opportunity to help support military communities and families, but it's also relevant for non-military communities as well. And so I think I'm really excited about this new space of there being choice for places to be engaged the way they want, choice for consumers to engage the way they want. And then on the back end, we're doing, we don't collect any identifying data from customers, but we are doing some analyses to understand, like, how do you engage businesses? What seems to work better in terms of pricing and that kind of thing? Because you do want to know the science or the data are helpful for the next iteration. Because of course we want to always be improving and we want to be doing the things that are the most effective and spending money the most effective way. So that's where this sort of science piece comes in on this.
Emmy, do you get kind of pushback from maybe any funding sources of their frustration with lack of data? It seems like Mike will be in some rooms and we'll say, hey, three to five people a day take a screening on Walk the Talk site. And we don't know the impact of that screening on that individual. It could have saved their lives. but it's seeming they want more data. Do you see an opportunity to better collect data in a way to accelerate the funding and the support around successful things? Or is it just going to be kind of like Jake says, of maybe there's a voluntary storage program and then there's a voluntary follow-up to say, hey, take part of the survey in 6 months, and it's not everybody's going to do that because that's sensitive information and it's going to take that much longer to get the data.
So for sure, I mean, I think this is where we definitely need better data collection in a way that is respectful and optional for people, right? Like we're not collecting anything that people don't want us to. But we need to know what works, and we need to know the effect of different, whether it's a screening program or lockbox kind of programs, or giving away locking devices. I want to be really, and this is maybe going to be a little triggering, no pun intended, for some folks who might be listening, but like I want to emphasize this is where federal funding for research has been really important. It's not that federal funds from like the NIH or the National Institute of Justice or the Centers for Disease Control, those funds should never be used to push an agenda or to be pushing specific policy. But there are no foundations that have the amount of money that government agencies do in terms of helping build the science. And so what happened was for a long time, basically there was a ban on federal funding for any research that mentioned firearms. So like if I had wanted to get a study to understand if Walk the Talk America screening was helpful, I couldn't get federal funding for that. They estimate that we're like, I don't even know that, like way so far behind in terms of where we should be in understanding the kinds of solutions that would work because of that ban on funding. Now, I can tell you in my own work, whenever we do this work and have had grants from the government, first off, the government has no say on what we publish or don't publish or how we analyze the data. We can't do any policy work, which we don't want to. And we always have community engagement from like a community advisory board. We've had people from NSSF, and I think you guys have been on something. So we always engage community members, and that's the way it should be. But I am really worried if all that funding disappears again, that we're going to be back to square one again, where we just don't have the resources to do the bigger scale studies to really understand what works. And so again, science should not be used to push a policy agenda, but we also need the science to know how to make things better for everybody. The same way we use science for cancer treatments and everything else, we can be using science for prevention efforts. So that is why this field is a little farther behind compared to, think about car safety or like road engineering and some of the other things we interface with on a daily basis that are like pretty sophisticated. We're pretty far behind in the science of injury and death prevention.
Yeah, it
To
makes
that
sense
end,
what you're
go ahead, Mike.
I was just going to say, it does make sense what you're saying. And I think me and you have been in public settings where I've said to you, like, don't let data get in the way of saving a life, because it just seems, I guess I have too many anecdotal stories, you know what I mean? So just like I said, when I first started convincing firearms manufacturers to put the free and anonymous mental health screenings in the box, my goal wasn't to get them necessarily to take a screening when they bought that gun. It was to literally be like, oh my God, like guns and mental health aren't mutually exclusive. And here's this organization from our side and Ruger and Bursa and Arms Corps, right? Like saying, no, like you got to do this. I just don't know how you measure that. And, you know, in the beginning for me, I guess one of my biggest regrets was I just want to get it in the damn box and go. You know what I mean? Like I just was like, yeah, man, like everybody just sits around and all these people do is jerk off in a circle and not do anything. You know what I mean? And it's like, everyone's so great. And I'm just like, let's just do something out of the box different.
Yep.
That, you know, I kind of didn't see, oh, maybe I should be tracking like what, at least what firearms company is sending a person through that screening or things like that. But, you know, it didn't matter to me. But I don't really, I guess I look at it as like there's been so much inaction on this stuff, and so many people stuck, and whether that's because of, you know, lack of federal funding it still didn't mean you couldn't move and get off your ass. Or look at all this other money that's not federal that could have gone to researching this stuff. And I don't even really care what the research says. Like, honestly, what you come up with the research, I'm going to say that's another reason why you need me. You know what I mean? Well, I'll just like keep taking you why I'm important.
I think you're totally right. And I didn't mean to sort of go off on my soapbox about like blah, blah, blah science, because there are a lot of things that we're doing right now. I can't tell you if they work or not. So one example, we, a couple years ago, as part of a project, it was, again, it like literally was an ER project where it was parents of suicidal teens. And we were encouraging them to move guns out of the house. And they were like, but where? And so we literally built the first map right around that hospital. It was an online map showing gun stores that said that they were willing to consider temporary voluntary storage of guns. And we were like, that's so cool. It's like a little map that people can use. So then we as a project, I had no idea if we would do anything. We had a student working with us one summer who then called all the gun shops in Colorado, and we built the first online map showing places willing to consider storage. Again, we weren't telling them how to do stuff. This was around the same time Armory Project and some other groups were getting going, kind of doing similar but different iterations. So ours truly came from a place of, we were like, wouldn't it be cool if we could just show it? It then led to all these questions of like, well, wait, how do you store guns? And like, what does the ATF say about that? And like, is it a lockbox thing? What if it's gunsmithing, et cetera, et cetera? So it's now led to where in Pause to Protect, we have a national map that was the data was collected by another group called Pierce's Pledge. So there's a national map showing all the locations who, as of last fall, said they were willing to at least consider storing guns. Does that map do anything? I do not know. Like, I don't know if people use it. I don't know if it's led to more people taking their guns out of their house temporarily. We've done some survey work showing many people do at times store guns away from home. But I think that's a perfect example, Mike, where like we needed to do something. I think it's led to a lot of interesting dialogue and questions and additional programs. We don't have data yet to say that it's saving lives, because that's really hard to measure. I still think it's the right thing to be doing, because it's building connections, it's fostering sort of voluntary action, and I think that's a good thing.
I want to go back to the funding issue, because we know that funding comes from funding sources that want something done. And I appreciate that way you laid out that science should not be influenced by agendas, but the fact is it is. And when you get a bunch of money to research a thing, it's unfortunately, I think it's become increasingly frequent that if the thing that wants to be researched does not come out in the funder's favor, they just suppress it and move on. And now the public is all up in arms about that. So they're very suspicious. And if I could put my cynic's hat on, I would say, all right, we got a lot of funding for quote unquote gun violence research and injury prevention, but is it driving to a certain direction, which is restriction? And I would say on the whole, that has been the message and the motif of most of the stuff that's come out of New Jersey and whatnot. So there's rightly, I think, some apprehension by people who say, you're gathering data, but what are the data pointing you toward? And I would say, what are the opportunities here to have somebody like you guys in Colorado or Mike and Estes, to say, let's study what's in effect now and ask, we could structure the questions how we want them. And sometimes you structure them the wrong way. Not you, but y'all. And ask gun owners, like we attempted to ask in our very informal internet survey, are you less likely to seek counseling if you have an ERPO in your state? Like nobody's asking that. And I'd like to know why. And if the answer is, well, we just haven't been requested to do so by whatever foundation is funding it, then I think the pressure needs to come from the researchers to say, we've got this big body of evidence. We know that there's a positive correlation between presence of guns in the home and, suicide and all that stuff. We don't need any more of that. What we need is the presence of policies that could be off-putting to clinical care access. Let's study that. And I think that we're long overdue for that. And I know there's millions and millions of dollars out there that could be used for that end. So the first question is that, what are the options we have, and how many opportunities do we have to maybe in the next year, 18 months, 24 months, to create something that either affirms or denies what our instincts are telling us is true. And then to that end, does it matter who funds it? Because we've recently all encountered some opposition and blowback from some people who thought that simply touching federal dollars, which, by the way, federal dollars is code for your tax money. So I don't really care like where it comes from. It's your tax money. Might as well embrace it. But some people don't like it based on certain administrations who may or may not be involved. And as Mike mentioned earlier, and you corroborated that we've worked across administrations now for many years. So two parts to that question. Can we go the direction we like the questions answered? And then maybe we have to shut up and go, it's not an obstacle to care. And then does it matter who funds it? Or
so great point, and like really big question. And not one we're going to answer today, but I think this is exactly the kind of dialogue that we need to be having to understand what are the questions people care about, and what are ultimately, so NIH, for example, is focused on health and injury and psychological health outcomes, right? So like NIH studies don't tend to focus on like home safety per se as an outcome, if that makes sense. Right. So each institute sort of funds a different type of body of work. And so everything is sort of framed in that space. I don't know if anybody right now is looking into the question you raised, which is really important, which is how do the existence of ERPOs affect care-seeking behavior? Because I do think that that's a really concerning thing, and with a lot of sort of face validity for why it may be true. So I think that the bigger answer is just like, yes, this is the kind of dialogue we need to keep having in terms of what are the important questions. So one example, Rand a couple years ago did this like policy database where they tried to look at the effect of different policies on different outcomes. What I appreciated was they didn't just look at things like deaths, but they also looked at things like cost of guns and ammunition and engagement in hunting and engagement in other sports, and to put it out not as this is good or bad, but this is what these laws do to different things. And I think that we need more of that kind of analysis, so that then we as a society with policymakers vote in the way we want them to be structuring things, right? Like at the end of the day, the scientists can answer some of the questions about the way things go, but it's not up to the scientists to be writing the laws. That's what we as citizens need to be doing. So the short answer is we need a lot more engagement and conversation, not just with the gun owning community around, say, suicide prevention, but also with people experiencing community violence and domestic violence, all of these things. What are the outcomes? What are the factors? What are the things people want to know about? The current situation in terms of does it matter who pays for it? So federal government and foundations, generally the good ones, like the ones who approach this ethically, which in my experience is really all of the federal agencies, are hands off in terms of the analysis, publication. They can't suppress reports. In this space, there is a strict separation between the funding and then the scientific integrity. And that's really important because that's a cornerstone of having results you can trust. I think it's a concern to me of foundations in particular if they are ever involved in decision making about publication. So pharmaceutical industry, that's where you definitely run into more of that, where businesses, if they don't like the way a trial runs, they might not want to publish it. The NIH, CDC, NIJ have no part in it. Same with Department of Defense, same with VA. There's a strict separation. The downside to federal funding, I will tell you, is the time it takes to get it. It's like a 15-month process to write a grant and have funding come through. So it's hard if you said, "Hey, Emmy, can you write a grant and like let's start this next month?" Like there's no way. That's the downside to federal funding. The real upside is the amount of money that they have. I mean, and to do big studies, it takes a lot of people and it takes a lot of resources. And so there aren't a lot of options to do the kind of large scale studies to really see if something works or not. Like if you're going to really study something, you need a certain number of people usually. And that's an example where like you need a federal study. this is where I would hope that we were talking before about like respect and engagement and acknowledging our own blind spots. So I think many of us in the science world are working very hard to bring up the exact kind of concerns that you've just mentioned and really have more robust dialogue about how we approach these questions. I also think more broadly, we need to be careful about jumping to the conclusions that like anything a federal agency touched is suspect. Most of the people who work at federal agencies are not political appointees. They've been there for decades across administrations. And I think we really need to take a breath before we assume that anything the CDC does is from the current presidential administration, for example, right? Like, because in my experience, vast majority of the folks working at those institutes are also big dorks who care about prevention and care about healthy communities and have their own political views that they don't share. And that's very different than a presidential administration with its own kind of agenda. So it's a really simplistic way of putting it. It's much harder in practice, but I think this is how we've got to be having these ongoing discussions and all taking a breath before we jump to conclusions about anything.
Yeah, and I want to, for the listeners, I want to confirm that. I know for a fact that I've worked hand in hand with some people that if I had to bet my life on it, I would say they wish that they could wave a magic wand and all guns would go away. They have never said that to me. They have never said anything negative about firearms. They have always stayed focused on saving lives and worked with me and asked me questions, took in information. I mean, I've had people on my, call me at 7 o'clock at night and said, I want to go this way with it. I've been offered this. Will this affect the work we've done? How will this screw it up, or will it at all? And I've said, yes, it will. And they said, okay, I'm not doing it then. Right. And like I said, I think, if I could guess this person, like I said, if they had that wand, it would all go away. But so I can confirm that these type of things are happening. It's not all doom and gloom. It's not all bad. And I love that I could potentially be working with somebody that's like not into it, right? Just like I could work with, I'm not into golf, and I can work with somebody that loves golf, and I could take the information in and, it's whatever. But, it does happen.
Well, other than podcasts, which I love, how do we restore the trust? Because there's a ton of people that we all know who are just super suspicious of anything that gets produced from any side. And for all we know, there's, Walk the Talk America could commission the highest fidelity, most rigorous study on the planet. And there's going to be people who go, well, yeah, because it came from the gun community. And then they just mentally throw it to the trash. And I think that's been going on for so long. How do we reasonably assure people that the research produced and the abstracts written and the conclusions drawn in those papers don't have somebody's finger on the scale? How do we do that besides more of this type of dialogue that's not behind the scenes? Because I believe you and I trust you, but I also know how this stuff works. And so it's hard for me to communicate. Just trust me, bro. Like the people are like, no, I've seen what the federal government's been doing the last several years, and I don't trust it at all. It's like, well, that's a valid point, but you also only know what you've been told through your own echo chamber, and that's probably not accurate.
Yeah.
How do we do this?
It's really hard. I think the way I've been approaching this work for the past decade, and I think especially with the situation we're in right now as a country and how divided we've become, the way I think about this is trying to role model the kind of person I want to be to people around me and how I interact with them. And that's somebody who listens, but who also questions and sort of speaks for truth, but in a way that is open to change over time, right? Like not being the absolute, this is the way it is because somebody said so, but but engaging in actual dialogue and like getting back to where did we used to be, where we talked to our neighbors regardless of who they supported or what they, if they liked golf or not, right? um I I believe deeply in this country we can get back to that, but I think it takes those little actions on each of our parts to get out of our whatever echo chamber you're in to move out of it and like push yourself to think about some of these things and push on the other side, whatever that other side is. Raise those questions. You know, some of these things, like if there's a scientist who cares deeply about preventing injury and death, but who's never owned a gun for self-defense, for example, they may not even know some of the questions to ask. And so they may not be asking them not out of some willful sort of evil plan, but just because they haven't thought about them. And so I think we've got to get back to the dialogue. And I think just it's like persistence on that front. And I have seen a lot of change over recent years. And so that's where I feel hopeful about our potential to improve the state of the science, improve prevention efforts, get all of us to that place that we want to be. But I think we can't jump to assuming anybody has ill intentions, whether it's somebody assuming that, oh, the whole gun industry is terrible, or somebody assuming the entire federal government is terrible. Like I don't know. I want to believe we're more nuanced.
Yeah,
That.
I mean, I agree. I just, from my chair, I see these. I mean, we're doing it. We're creating a 2A mental health provider directory, right? And that sounds great. But why in the hell would we not trust any old random clinician off the street? And I'll tell you, it's because anecdotally, people see on Instagram clinicians posting their political biases that openly reject certain demographics. Like that's a problem, right? And anecdotes ring true, just like the evening news with its headlines will set a tone on this one thing that happened, this one community, to this one person, and then we generalize that to be truthful for all encounters. And somehow we gotta desensationalize what's going on, and we gotta move more toward the center. And I mean, maybe just more podcasts. I don't know, maybe that's my bias.
I do think more podcasts, more interviews. You know, I will say I was disappointed in some of the recent stuff that happened. There wasn't an attempt at any kind of dialogue or like actually getting both sides of a story, for example. And I think that's always a missed opportunity if we jump to repost something or just assume something is true instead of like looking for the nuance. I think we're really missing out. So I'm excited to keep working with you guys and others from the community who are interested in this space. You know, there's these injuries and these suicides and deaths are preventable. You guys know that, and I hope your listeners know it. But like, I think we've all got to be engaged in this space and instead of arguing with each other. So I'm looking forward to keeping the collaboration going for sure.
Yeah, and I know we're up against it. I got basically two questions, Jake, unless Kevin, you guys have anything else. But first one, I want to ask you: can you tell me something? Maybe it's an anecdotal story of where you saw Pause to Protect work for somebody or just help somebody. And I know it's like putting you on the spot because people do it to me all the time. They're like, give me a story of, and then I go blank. But just whether it's not, just something that you said, damn, this is working anecdotally here,
Yeah. So, and Pause to Protect is a program for shops, not so much individual customers. So I don't know which the names or anything of customers coming in. And so I can't tell you those kinds of stories. It has been an absolute dream for me to have this program and through the program be able to, our team was able to hire this incredible woman, Jacqueline Clark, who is leading all of the outreach.
Friend of the show, Jacqueline Clark.
Yeah, but to be able to to work so closely with her and honestly give her the resources to go out and work with shops and I know she's gotten really good feedback from the people she's working with. I think shops who are maybe interested in doing this but didn't know how to start, and now they have a little tiny seed pot of money and some technical assistance. That feels incredibly good to me because I think I've got to believe that that's doing good. Has it prevented people from dying? I don't know, but I do think it's changing the narrative. And I actually do have something I want to add, Mike, if it's okay. Because I don't think I clarified this earlier, and I just want to make sure people are totally clear. So Pause to Protect as a program is funded by the Defense Suicide Prevention Office. Our program at the University of Colorado is predominantly funded by the medical school, and then different faculty have research grants for different things. So, like, one of our faculty members has some money from the National Institute of Justice to look at extreme risk orders, for example. Those are separate lines of work. It's kind of like if you're a consultant and you work on a bunch of different projects at the same time. So, Pause to Protect itself has no direct funding or connection to the NIH, to the NIJ, to any political administration. It is a Department of Defense program, but the DoD also doesn't have any say over kind of. I mean, they funded us, so in that sense, they have a say over what we do because they know what we're trying to do, but they're not getting any data. They don't tell us on a day-to-day basis kind of how to be rolling things out. And I'm happy to answer questions after the fact if people have more questions or concerns about sort of the money flow, but I do think that's important to make.
Yeah, let me add to that real quick. For people who've never worked with grants before, grants are extraordinarily hard to obtain. There's tons of paperwork behind the scenes, but usually the way it goes is they don't just give you a pile of money to do whatever you want with. There are obviously guardrails. You can't just apply. I'll use something in my realm. If I apply for, say, community-based suicide prevention, Zephyr would never qualify because we're a for-profit entity, but let's say we do, right? We get this. They'll say you can use it for teaching materials, transportation, and not salaries, right? Something like that. And you go, wow, that's really tough because now how am I going to pay my people? But that's how they go. So when Emmy talks about the Department of Defense says what you can do with the money, it's broad enough to be useful, but narrow enough that you can't go out and buy sushi with it. You're not taking
Right.
golf outings. You're not
Sushi.
right. So
No golf.
yeah,
There's no getting rich. That's for sure.
yeah, we wish that there was more latitude to grants because oftentimes when we get into the grant funded world, you're especially with these community organizations, like I do a lot of working with sexual and domestic violence prevention, and they'll be pulling from many grants for one agency. One grant is specifically for care. One grant is for prevention. One grant is for outreach. One grant is for shelter. One grant is for clothing. It's like, man, I've got all this money, but it's so finely stratified on the budget that you can't pull from one if another is bleeding because you have more demand for, say, clothing than you do for shelter. It's very, very, very challenging. Very challenging. That's why a lot of people don't want to work with grants. So when you hear her, it's not like the Department of Defense is saying like, hey, look the other way and only do this thing. There's no agenda to it. It's like, here's your gunshot program. Go do it. Right. And beyond that, as long as you're staying within their parameters, you're good. But sometimes they're not that easy to work with. So it is tough. And I want to say too, if it's not evident on its face that we all get along, I would invite you to take like 2 large steps back and take a breath, because this should be just the fact that we're talking about this should be evidence that there's no sort of Trojan horse approach here, right? Like you don't get organizations that have organizational reputations with their communities to just throw that social credibility or social capital away because they want to like get 25 cents from something. Like it doesn't work that way. And all these gun shops that have signed up for the thing, they're selling guns. Like they're not interested in losing their customer base. Jacqueline runs a gun range, right? Like she founded and owns a gun range. So if you ever have any suspicion about like, oh, Walk the Talk America's working with the med school, it's like, yeah, there's probably a really good reason for that, and it's because we're helping people. So
and
that should be evidence unto
Jake,
itself.
right, where you like take a breath and be like, and then just ask. Like, I think all of us in this space are pretty transparent. Like nobody's trying to hide anything, and always happy to answer questions about that. But I think I just hope we can all in this space and in others get better at not jumping to conclusions so quickly, and not assuming the worst of people. Honestly, too. Yeah.
But Mark's got another question though.
All right. This is a question that we ask all of our guests, and there's no, I mean, just whatever comes into your head. How do you tend to your mental health, Emmy?
Oh, No, that is a super important question. So I have certainly had therapy in the past. My opinion, everybody should have therapy at some point in their life because it's kind of an amazing way to get to know yourself. Now it's a mix of exercise, naps, and cocktails. Not always in that
Yes.
order, but yeah.
Amen to that.
Particularly Manhattan's up in the Rocky Mountains when it's snowy outside, maybe my slice of heaven. So
Carpano Antica Vermouth.
the what?
Carpano Antica Vermouth in your Manhattan.
Is
If you
that like the old school one? I don't know.
if you don't know it, go buy a bottle of
Okay.
Antica by Carpano. Like it's great. Like
It's good. Well, I
My
will say
Costco sells it.
only the good cherries, the like fancy, the real
Yes.
cherries. I'm a little snobby about that.
Yeah.
Yeah.
Luxardo.
Sorry, they're so good. I always have two. Yeah.
Pro tip: if you have parents with a cherry tree, harvest all the cherries, pit them, and can them yourself in a bourbon sugar syrup.
Oh, that is well. In all seriousness, I should say alcohol is not the best approach to mental health wellness. Cocktails are part of it, but Mike, I appreciate that you guys asked that question because I see a lot of bad stuff as an ER doc, so I've had to curate a lot of approaches over the years, and I think the main thing is you can't stuff everything down. You got to process, and there are different ways to do that.
Yeah, and you mentioned earlier, if someone has a question to just ask, where can they ask that question?
Yeah, I think probably the best thing, what we'll do is, can our website has my email on it, so we can do it that way, or I can give it to Kevin to put in the show notes. Yeah,
Okay.
I'm
No,
okay
it's
with
just fair. I mean, I think, we're telling people be mature, don't overreact, ask a question,
yeah,
they got to be able
yeah,
to get there. So,
yeah. I will tell you, I'm not gonna I won't respond to just like nasty hate stuff that's not a question or that's not engagement. Like
well,
that's
real quick, I want to point
yeah.
something out, and this is to my people. Jay Hood is a board member, Jaron Clark, who
Yeah.
works on both sides, very pro 2A, doesn't have a non pro 2A stance. And after all this drama blew up, he got death threats. Like,
Did
that
he
pisses
really?
me off. Yeah. Yeah.
I did not know that.
Yeah.
That is crap.
So he also works with Pause to Protect. We're so lucky to have him as well. I feel bad I didn't mention him and Jacqueline in the same breath because they're this incredible dynamic duo. They are not related to each other for anyone who's curious. But yeah, he got some sort of nasty anonymous threats, and we had to do a campus security report. With campus totally has our back, but like that, it just made me really sad because it, it was all based on assumptions and misunderstandings, and he's out there doing such good work, and to have and he's a tough guy, so he said he was fine, but still no one should have to go through that. So
Oh yeah, I mean,
well,
messing with him would definitely be messing
yeah,
with the wrong guy. But he was with me from day one. He saw me speak in Colorado day one about Walk the Talk America. We developed a friendship for that. I was able to bring him on board as an advisory board member, and I think I was part of the process of recommending him to Pause to Protect and your whole conglomerate, right?
yeah,
Him applying on the scene, being able to say that he worked with me. So it was very
yeah.
frustrating. We have
Well,
one more. Can
and
you take?
I think he's going as well. Our team is going to be at SHOT Show, so if anybody's going to be there, stop by our booth to say hi and learn more about stuff. Yeah,
Nice.
yeah.
Okay, yeah, that's
Um,
good.
Did you say
see
You
something?
get
question in the
Yep.
chat. Yeah, can I answer it?
Oh, I'll just read it. Thanks, DJ. What do you think? One of the best ways to deal with divergent views, specifically when trying to come up with solutions. Maybe we could all answer this
Yeah.
in our own perspective. Go ahead, Amy.
So I will say I try to think about a common goal and where that person and I might agree on something, right? Like that we might have an outcome. And then I try to just be transparent, but genuinely curious. So ask questions not in a confrontational way, but like, tell me more about that, or can you explain that to me? I think we all want to be heard, and I think listening to others is a good first step.
Miguel?
I got. I got. So what I like to do is, and Jake's big on this, is just validate what they're feeling, right? So when I'm talking to somebody and say let's just use the anti-gun, the anti-gun versus me, right? We're at the bar and someone says, "Hey, you're a gun guy," like, "Hey, ask a few of these questions." I always try to say, "Hey, look, like we both agree that, life loss, especially when it's unnecessary, it's tragic. But we're going to have this gun conversation, and it's going to go one or two ways. Regardless of how this goes, I'm going to buy you a beer after this, and we're still going to be friends, and we can hug it out." But I always say, after we're done talking about this, you're either going to have to rethink the way you feel and the approach you're taking to firearms, or you're going to say, "Damn it, I just hate them because I hate death, and I just wish that I could have a magic wand and they'd all go away." Even though that is cartoon world, Christian Conti reference, everybody take your drink, right?
I don't have a drink. You didn't tell me to bring one.
It's okay. It's an inside joke. Joke for the show. But even though that's not realistic, I can appreciate that, because in the end, you just don't want to see people dead. And usually, when I do that, it works every time. And I had a lot of people say, I need to rethink this, but it always ends in a hug. You know what I mean? Regardless of, even if the person said, "I just wish they'd all go away," and it always, it's breaking bread with people.
Yep.
Yeah, not getting angry at them for being ignorant or gun ignorant about something, because they're truly asking. So that's how I do it.
Emmy's answer is probably closest to mine, which is, tell me more. Because what I'm doing is I'm modeling that I'm willing to change my mind based on their information. I might not, but I will at least provide an audience for it. And if you want to learn more about ego defenses and like conscious and unconscious function and why we see the world the way we do, there's a video on the Zephyr Wellness YouTube channel called A Brief Model of the Psyche. There's parts 1 and 2. But I explain on a dry erase board how the psyche works and how we get into very defensive frameworks based on what we think we know about the world. And if we're not humble enough, curious enough, and have the strength and integrity in our own souls to receive new information and integrate that in and change our own minds, we're going to end up in fight or flight mode, and we're going to be defensive, and we're going to push people away. So I'm not going to get too into that, but one great way is just simply to model that you're willing to change your mind and ask. Now, not everybody is going to follow that lead. Some are just interested in debating to change your mind or the other person's mind. But before you go there, ask to hear more. And then if it looks like the conversation's going sideways, you say, "Hey, hold on. Are we discussing this to change each other's minds, or are we just discussing to get out new ideas and new options?" And depending on what flavor you want to go there, it's up to you what direction you want to take. So that's my 2 cents.
Kevin, you got anything?
No, I think it's elements of just that, of just changing the goalpost. The goal isn't to change that person's perspective 1 inch in that conversation, just expose them to an alternative way of thinking, and then let them have time to digest that. And maybe they'll change it in time, maybe they won't. But so many people try to change people's opinions right then and there and put so much weight on that movement that they miss just educating someone on their point of view.
Yeah, it goes back to what's the goal, right? If we start throwing interventions at people, we may not ever know that we hit the goal. So let's ask what the goal is first, and see where we're going. So I sure do appreciate your time. Thank you for carving it out.
Thank you, guys. This is a great way to start the week. Yeah.
Amen. And if you want to learn more about us or donate, WTTA.org is the website, and we thank you all for streaming, downloading, tuning in. I don't think anybody uses a tuner anymore, but we appreciate your paying attention. And on behalf of the entire Walk the Talk America family, we wish you all great mental wellness.